Good morning. In the year 2020, there were two gentlemen. One was called Mukasa Peter, another one was called Lutwama Joseph. They both had difficulty in urination. Lutwama Peter went to Mulago Hospital, did an ultrasound scan, and was told he had a small mass in his prostate. He was advised to do a biopsy, which later confirmed that he had cancer of the prostate. Later on, Lutwama Peter's prostate was removed. He was given different preceding chemotherapy, and in the year 2022, Lutwama Peter was declared cancer-free. In the same year 2000, Mukasa Geoffrey from Bogerere had similar symptoms. Mukasa Geoffrey thought these were infections, and he accused his wife of spreading infections to him. He went to shrines and a few drug shops and was given few medication to handle his symptoms. Definitely some of the symptoms went away. In the year 2000 and 2012, Mukasa Peter came to Mulago Hospital. When his symptom had worsened, by then he was passing blood. He was scanned. They found a large mass in the prostate that had invaded the nearby organs. A biopsy was taken off, and Lutwama Peter was confirmed to have advanced prostate cancer in stage 4. In the year 2022, Mukasa Peter died, while in the year 2022, Lutwama was declared cancer-free. I want to ask all the viewers watching, what do you think killed Mukasa Peter? Was it having prostate cancer? Was it not going to the right places because he went to a shrine? Was it denial? Or it was something else? My name is Mr.Selfcare, and this morning I'm here to discuss yet a very important topic and discussion about prostate cancer. We are privileged this morning to be joined by someone that is very passionate, my colleague from Lagos Hospital, someone very passionate about cancer and other non-communicable disease, a learned friend, and someone that has been dealing with research for the longest time of his knowledge, his time. We are talking about a cancer that has almost 2,000 new cases every single year, and sadly killing half of this number in less than 5 years after diagnosis. To so many, cancer is a death penalty or a death sentence. But this morning, we want to clear the myth, we want to change that statement, and we want to convince you and teach you that indeed cancer is not a death sentence because science does not say so. To join us this morning is Dr. Nkalubo Jonathan, all the way from Mulago National Referral Hospital and a few other places and organizations in Uganda, that is going to take us through this well-informed and great discussion. Yes, Dr. Jonathan, you're welcome.
Thank you very much, Mr. Selfcare, for hosting me. I'm always happy to educate the nation and the world about health. and today's topic was well thought of.
Mm.
And this month we are discussing very many cancers, though they are
Mm.
focusing on the ladies. But I'm glad that
Yes.
you picked a topic that addresses the men. So today we'll dive into prostate cancer for you to
Y-
understand what causes it, what symptoms does it show, are there any
yes.
tests that we can do to to diagnose it, and are there any treatments? Is it curable? So we'll also be happy to answer some of your questions in the chat. I'll begin by first of
Uh,
all, yes,
yes, Dr. Jonah, how is Mulago Hospital?
Mulago Hospital is, as usual, quite busy.
Yeah.
I work in the emergency unit and we see many patients. The numbers are growing each day.
Yeah.
We've
So,
expanded, we've expanded
yeah,
the place
yes.
to accommodate these numbers. On a day, I think we see about 100. We admit about 80 patients, but we see over 200 patients walk in the hospital for different reasons.
Um, I think on another time I will invite you here when we shall be talking about emergence and actually what kills actually people before they reach emergence. I've seen you on a number of radio stations and TV stations and also outside Uganda talking about NCDs, especially prostate cancer. Dr. Nkarubo, as we start, what's a prostate and what does it do in a man's body? To help some viewer out there that want to understand, because they are men who cannot point to their prostate right now. Let us start
Okay.
there.
So the prostate is an organ that is in men. Women do not have a prostate. And this prostate is located in the urinary system.
Mm,
The way God created the urinary system is that we have the kidneys up there, and then there are small tubes called ureters that bring the urine into the bladder. And
mm,
after that, we have the urethra. The urethra
mm,
is a small tube that helps the urine come out of the bladder. Think of the bladder as a balloon.
mm,
So this prostate gland is found just below that balloon or the bladder, and
mm,
it covers the part of the urethra. So that urethra has a part of it that is being surrounded by the prostate. And as we will explain going forward, most of the symptoms that we get are with the urinary system. So this organ also is near nerves and blood vessels that
mm,
bring blood to the male organ, which is the penis, and this is responsible for erection.
mm,
So when the blood and the nerves are working well, blood will flow into the penis and then it will erect. So you find that people who have issues with their prostate, when it enlarges, it presses onto these blood vessels and nerves, which takes away their libido and also affects their erection. The prostate secretes an important fluid called seminal fluid. So it makes secretions, and
mm,
these comprise what we call the seminal fluid.
mm,
So the seminal fluid is a fluid that keeps the sperms healthy, and when a man ejaculates,
mm,
the semen which gets its color as white, there's a
mm,
special fluid that keeps this sperm healthy, either storing and giving them food, giving them a good pH so that they do not die off. So that is how the prostate, that is where the prostate is found, and it is in the size of a walnut, or some people may think of it as a small guava, or I don't know whether we can be able to show people how a walnut looks like. So the science says it is the size of a walnut.
mm. Okay. Thank you so much, Dr. Jonathan, for taking us through that anatomy. To people watching us right now, the image you're seeing on your screen, the it is that is a bladder, and below it, that heart-shaped O thing that you're seeing is the prostate. So the prostate just surrounds the urethra. The urethra is that tube that you're seeing that is taking the urine out. The big orange or red thing is the bladder. So that's what Dr. Nkalubo is actually trying to help us understand. Doctor, let's start here. You've told us prostate, and now we know what it does and where it's located. Then, what exactly is prostate cancer, and how does it develop in the body? You're muted.
I'll first of all separate the two words, prostate and cancer. So
Yes.
cancer in itself, it means that the cells in the body are dividing rapidly, or God made it that every day or every microsecond, the body is making new cells, but at a given rate. For example, if God made it that every 2 minutes a new cell should be made, or every 2 minutes 10 cells should be made, what happens in cancer that is that we have overgrowth, means more and more cells are being formed, and now these are cells in the prostate. So the prostate as an organ is made up of cells, and when someone has cancer, we see that these cells are dividing rapidly, which contributes to this different changes that we see in the prostate cancer, such as the increase in the size of the prostate, and the other nodular appearance of the prostate on sonography. But basically, what you need to know that is prostate cancer is an abnormal growth of cells within the prostate, and this makes the prostate bigger and also change its normal appearance. And just to make you know that this is a very serious problem, prostate cancer is the second most common cancer among men worldwide.
Okay.
That is following after lung cancer.
Mm.
Whereas in Uganda, it is the number one cause of cancer in men. We see a
Okay.
lot of men coming in with different cancers, but the majority come in with prostate cancer. This makes you know that it is a very big problem.
Dr. Jonah,
Yes.
you've told us cancer is the most common cancer. Actually, prostate cancer is the most common cancer amongst men. Why is prostate cancer becoming so common among men in Uganda today?
So looking at the different risk factors are things that increase your chances of getting a disease.
Mm.
And we have why are we having this is because of very many issues, but the key issues is going to be around diet and lifestyle.
Mm.
It is said that men who are consuming a high fat or high dairy based diet are at a
Mm.
risk of getting prostate cancer.
Wow.
Whereas also another theory says that sexually transmitted diseases like gonorrhea
Mm.
is another very big risk factor to getting prostate cancer. And we
Mm.
see very many men's sexual lifestyle is not the best. Most of the men are polygamous or having more than one wife,
Mm.
and it puts them at a risk of STIs, and then eventually we see them getting prostate cancer. Then these risk factors, we have those that we have control over and those we don't have control over. Uh, then we have smoking. Another
Mm.
theory these days we have been testing is that we have most of the men coming in, and these are farmers who are exposed to pesticides.
Mm.
You realize out of every 10 patients I see at Mulago who come in with features of prostate cancer are from the village, and their main job is farming. So
Mm.
it is said that in certain pesticides, they are chemicals that will alter the person's DNA and hence bring about the prostate cancer.
Mm.
Another thing that we don't have control over is that risk factor being black alone increases your risk of getting prostate cancer.
Oh.
So it is said that the black race, we are predisposed to many cancers because of our genetics. So there is genetic predisposition. And then if you have a family history, or in case in your family you have anyone who has had prostate cancer, it increases your chances by 2 to 3 times that you may have prostate cancer also in your lifetime. So those are things we need to really watch out for, and these are some of the things that we see. But in Uganda, I would blame mostly the diet and lifestyle and the sexually transmitted infections, because we don't smoke as much as I think I used to see many men when I was growing up.
Doctor, you've talked about so many risk factors, and you say that there is now a growing concern among farmers, which could be maybe due to the pesticides or fertilizers or things that they are using. They could be responsible. What about the increasing way by which our factories are dumping waste products in our water sources, of which some could be having lead and mercury that some literature says highly responsible for some of these cancers?
I think that is also right, because we've said the pesticides, besides
Mm,
the people who are the end users who use them,
mm,
we also see the factories that manufacture them and also manufacture other carcinogens.
yes.
And we see there is a very poor drainage in our cities,
Mm,
and we see many people have contact. There's a lot of consumption of unboiled water, especially in areas surrounding these factories,
mm,
because we rely on wells.
okay.
Most people do not have tap water, especially in those areas. So we find these chemicals finding their way into our houses through the water we drink.
Mm.
Yes.
Uh, Thank you so much. Doctor, this is coming on from Jordan. Jordan is a professional photographer. Can you help us understand the early warning signs or symptoms that men should never ignore? But shortly before you do that, I want to encourage every man listening in that we are talking about the most dangerous cancer in Uganda. And men naturally have poor seeking, health seeking behavior. So chances are you're watching, but you're not going to go to the health facility when you have these symptoms. And to every woman watching in today, can you encourage your boyfriend, your husband, your son, or your father to watch along? Because the moment you move away, they are going to switch away from this channel. Again, if you have a comment or a question, can you leave it in the comment section such that Dr. Jonathan will respond to it? Doctor, what are some of the early warning signs and symptoms that men should never ignore?
So prostate cancer is quite a special cancer, because many of our patients do not show any symptoms in the initial stages, and we only see symptoms a bit late. So many men with prostate cancer come in with no symptoms at first. But as for men who do routinely come into the hospital, we find it that we are able to do some tests, such as the prostate specific antigen, the PSA, and then the routine scans, abdominal scans, can also help us to diagnose this early. But among the symptoms you should know about that we see in the early stages of prostate cancer, we mainly the first symptoms we see that come due to the increase in the size of the prostate. We have another condition called BPH, or benign prostate hyperplasia. This is just a big prostate, but it does not have cancer in it. But as I explained to you, that the cancer cells are dividing rapidly causes an increase in the size. So the initial signs that come are due to a big prostate. We only diagnose the cancer later when the prostate is bigger and bigger and we've done biopsies. So the first symptoms that you see are symptoms that will be in the urinary system. These are basically having urine incontinence. That means you have no control over your urination. That means urine just comes out. We see this in men about in their late 50 to 70. You find that you no longer have control over your urine. You go for a party, you're seated, and then you find you're wetting your trouser. Another one is a poor stream. Remember when you're growing up, as we used to play a childhood game where we go to the toilet and see who raises their urine higher than the other in the bathroom. So you try to see that this angle, initially when you're young, it would be very high up.
No one
And
warned
then
me. I used to win that game.
so, but now you try to see someone who used to shoot higher, you're now shooting lower. That is the urine stream. That is the flow of the urine from your genitals. And now the stream is not that much. And then there's a feeling of incomplete emptying of the bladder. You go to urinate, but then you feel like you still have some urine left. But you try to push it out, it is not coming out. As I explained to you that the prostate sits just below the urinary bladder, and around it is the urethra. So if this prostate becomes bigger, it starts compressing onto the urethra, and then you have issues with your emptying. It means that all the urine does not come out and some remains. So that's another symptom that we see. But as the cancer progresses, we start seeing blood in urine. So you go to urinate, your urine is no longer the clear color or yellow color, but you see some blood. For some people, even they think it is a bit pinkish or Coca-Cola colored. So this is a sign that really should alert you to come to the hospital. And then another thing that we see is blood in semen. When you go for your sexual activities, when you ejaculate, you see that you have blood in the semen. That's another thing that should worry you, and you should really come in so that we rule out prostate cancer. Another sign and symptom that we see is urinary frequency. Because you've not emptied your bladder very well, you feel like every time you want to go back and urinate. And then there's another thing that some men are having is when you go to urinate, you fail to start immediately. So you have trouble getting started when trying to urinate. And then if you wake up a lot in the night to urinate, it's another telltale sign that it really needs to alert you to come. But now, prostate cancer itself, in some of the stages, it starts to spread from the prostate to the nearby organs, and then we start seeing certain signs and symptoms in the advanced phases. These include back pain. The prostate is an organ in the pelvis and it is near the lower back. So we tend to see patients coming in with back pain. Actually, all the patients I've diagnosed with prostate cancer did not come due to urinary issues. They came due to back pain. And when I was investigating them, later on we found that they have prostate cancer. Another thing is bone pain. This cancer likes spreading to the bones, so you start getting bone pain, especially the long bones. The long bones are those of the thighs, those of the legs, and then another thing we see is difficulty getting an erection, which we call erectile dysfunction. So men with prostate cancer or enlarged prostate start getting issues. As I explained to you that the prostate is near the nerves and blood vessels that bring blood to the male organ. If the prostate enlarges, it compresses onto them, and then the blood and the signals are not received. Therefore, you have issues with your erection. And then later on, such people start feeling very tired of it, fatigued. There is weight loss. You start losing weight, but out of nowhere, you're not exercising, you're not dieting, but then you lose weight all of a sudden. And in the later phases, we start seeing weakness in both arms and legs. So these are things that should alert you to come in and see us.
To the fellow men out there, you could be having issues with your manhood, you could be having issues in your sexual life, and you think it is just any other thing. So you're busy taking, those money power drugs, not knowing actually you're having signs and symptoms of prostate cancer. This is why we wake up every Sunday morning to come here and invite experts to come and have a discussion with us on different healthcare. Let us talk about awareness and screening. Many men fear or avoid prostate cancer screening. Dr. Jonathan, what are some of the myths and misconceptions you've encountered in this work of screening and creating awareness about prostate cancer?
So in my work, I've seen many people feel like they should not screen, and the common myth I see is that is among the young men. They think that prostate cancer only affects older men in their 80s and 70s. Another myth I've seen is that prostate cancer is a death sentence. When you're diagnosed, you're going to die. And then some people also think that when you go and test and they find you have a high PSA. I say the PSA is a specific lab test we do. We take off blood and check for this prostate specific antigen. We sometimes find it high, but not all high PSAs are due to prostate cancer. And then some people think that when we tell them that you have a diagnosis of prostate cancer, but they don't have symptoms, they mean that they do not have cancer. So these are quite myths that many people are having, and we need to work as health workers to break them and teach people about them. And then some people also think that if in your family you've not had this cancer, it is not you won't get it. Some other myth I think people have is that when you start treatment for this cancer, it may ruin your sexual life. And then some people also think sudden changes in diet when you're diagnosed with prostate cancer, you'll not have the prostate cancer. So these are really myths that people need to know, that these we are trying to teach you so that you know how serious the disease is, the rationale of screening. Many people shy away from screening in our countries, in the low income countries, because of the fear of the diagnosis itself. Someone says, I will go there, I've gone to test for a UTI, but then I accidentally find I have prostate cancer. Let me not go. And then we have a lot of herbalists. People are believing in the herbalists more than us. Many people have seen with prostate cancer present in late stages. Yet, if this disease is found early, it can be treated and cures. So we have a very big role to play. Sorry.
Dr. Jonathan, you've tackled something very important. I want to ask: is prostate cancer curable, or can it be treated completely?
So prostate cancer is curable, but with conditions.
Yes.
It is curable if identified early and treated well. So people need to know that this is not a death sentence. When you're diagnosed early and you get treatment, you'll be well. I've seen people who have been treated and they are living their normal life, like the case Mr.Selfcare gave us at the start of Lutwaman, the colleague. So if you come in early, we diagnose you and we start treatment, your chances of surviving are very high.
Okay. Friends, that's why I didn't discuss this myself, but I brought someone that deals with these things every day. When we talk about these cases, some of the young people are busy watching Arsenal and Man U thinking, oh, these should be classes in the elderly. No. Of late, science proves that cancer does not discriminate on age because the causes, like he has said, are so many. Dr. Jonathan,
yes, please.
Someone has seen the signs and symptoms. What are some of the recommended tests for prostate cancer? And at what age should Ugandan men start getting these different screening or tests?
Okay, so we diagnose prostate cancer in a wide range. As we said, these days cancer does not discriminate between the young and old because of the changes in our lifestyles over time and the dieting. If you are 45 and above, you need to go to the hospital and screen. And what are some of the tests that the doctors will recommend? Number one would be a simple blood test called a PSA. The normal PSA is between 0 to 4 micrograms per mil. So if they test you and find it higher, it is suspicion that you need to do a scan. And the scan you need to do is a simple abdominal pelvic ultrasound scan. It is safe, has no radiations, and it will give us information about your prostate. What is the size? Are there any changes in the way it looks? Is it nodular? Is it a smooth? Does it have a smooth outline? So these are the most common tests that we do. But besides that, not everyone is able to afford a scan. If you come to me as a good doctor, I'll do what we call a dictal rectal exam. A dictal rectal exam is a simple test. We just get our gloves, lubricate one of our fingers, and then insert it through your anus to go and feel the prostate, because the prostate is near the anus, is near the rectum. So we're able to feel this prostate, whether it is large, whether it is smooth, whether it is nodular. And when we find this, then we can go ahead to do the scans and also do what we call a biopsy. Biopsy means we get a biopsy needle and go pick a sample of your prostate, especially the part that has shown changes. Like the image showed us, you see on your right, is the where the lesion is, and on the left is a normal part. So when you do the scan and you see this part, you're able to go in with your needle and pick a sample that we take to the laboratory to analyze. And what we look for is are there cancer cells? If they are there, what stage are they? Because this cancer has stages. And when we stage it, we're able to now direct the treatment.
Okay.
In the developed world or in good hospitals, they can also do a transrectal scan. Instead of pushing the finger, they get a simple probe, push it through your anus, and they're able to see the prostate well. But what we are looking out is that in
So,
advanced stages of the cancer, now that it has spread, we'll go ahead to do other scans. As I talked of the bone pain, we'll do bone scans. We can do PET scans and MRIs to further diagnose this condition and how far it has spread.
uh, thank you so much, Doctor. You have talked about so many things. You said some people can do blood tests. I used to see you ordering for a lot of PSA blood screens. Some people can do ultrasound, rectal or abdominal. Some people can do akanyama, which we call biopsy. Akanyama kumena abasajja bakatya nnyo. So many men are scared of going for okubajjako akanyama. And so, doctor, so who goes for what? At what stage does omusajja go for biopsy? At what stage do we go for biopsy? At what stage do we do that? Because you've said so many things, but there is a man who is already scared. He's scared that if he goes for screening, they are going to take off a kanyama or a biopsy. Who goes for biopsy? At what stage of testing does one need to go for biopsy?
Okay, so when we do a scan and find that the prostate outline is nodular, it is one of the things that push us to go to do the biopsy. And also when we find a PSA when it is very high, because normally this cancer starts from within the tissues of the prostate and the nodular pattern appears later. When we do a PSA and it is abnormally high, for example, I'll say the normal range is 0 to 4. We do a PSA, it is 100. It is something that can push us to do a biopsy. So I've said men above your 40, you need to go and screen. When you find any suspicions and you have some of the symptoms that we've talked about, we need to check the prostate.
Okay.
With biopsy, basically we are biopsying lesions. And most of these are done under ultrasound guidance. You put your probe and you see the lesion and then direct your needle towards the lesion and you pick a sample.
Doctor, you've talked about early screening and encouraging people to go for screening. Now, let us go for hardy talks. How accessible are these screening services in rural areas of Uganda? And what do you think can be done to increase accessibility and affordability. Because yesterday when I was planning this show and asking viewers for questions, one of the biggest complaint was about accessibility and affordability. So my first question, how accessible are these in rural areas? And what do you think as a public health advocate can be done to make sure that they are both accessible and affordable?
Okay, we are in an era of technology that it is trying to spread, but one thing we need to do and advocate for is training good doctors. We have very many medical schools coming up, teaching everyone, teaching radiography, teaching clinical officers. You find a nurse posing as a doctor. So we need to train very good clinical people. That means not scan people who will just go and replicate the scan. We need to we need to train. As I said, we may not be able to have scans in the village, but if you have a good doctor who can know the signs and symptoms, who is able to do a dictal rectal exam. This is rarely done by many doctors. They don't want to go in to check for this. But a good doctor who suspects that a patient may have prostate cancer, with just a dictal rectal exam, it can be able to know that I need to refer this patient for a scan. The PSA is not very common. You only find it in the towns. So when the doctor finds that there are telltale signs, they need to refer the patient to a place that can help them. We have a new growing habit of medical practitioners not wanting to refer patients. They want to milk all the money from you, and when it's done, they will refer you. We need to make sure that we work with our doctors. If you see the doctor is not adding value to your health care, for example, is not giving you the diagnosis, so he talks about it, but is not referring you to the place that needs to address you. In Mulaga's hospital, when we get the diagnosis of prostate cancer, we immediately send you to the Cancer Institute to see the oncologists who go ahead and start you on treatment and follow you. So we need to advocate for training. And then also we need to now leverage on media. We have a lot of social media. How are we using our TikToks? What we're only seeing memes. So every day there is another meme, but these memes are not on our health. They're basically on the different lifestyles. So how I wish that we can leverage media to continue teaching people. What are our children watching on TV? If our children got to know these things earlier on, then they will be able to know that, hey, when I click my 40, I need to check for this. When I have a brother or father who has had prostate cancer, it needs to raise my suspicion for me to go for a scan. Remember, health is paramount. You may be thinking you're saving some money, as I see Olivia in the chat as is talking about painful income, painful. People don't want to invest in their own health. So you need to know that as a man in my 40s, I'm having issues in my bedroom. You need to go and see, is it my prostate or the other issues? People like herbs these days. Herbs have become herbs. Even me tomorrow, I can wake up and go and cook some tree, and I get market easily. But so we also need to work with these herbalists and make sure that we teach them on when do they need to send these patients to they call it abasaba bazungu. So we need to really educate the public from the grassroots to make sure that they know the symptoms and where to go, when to go.
Jonathan, you've talked about early screening and detection of these cancers. So a friend of mine, maybe Lukwago, lives Katente, Mukono, and then comes to Mulago, we screen, and maybe we diagnose them for cancer. Biopsy is taken off and diagnosed. Maybe this Lukwago friend of mine has cancer. What next? In case prostate cancer is detected early, what are some of the treatment options that we have in Uganda today?
Okay, we are glad to say that now medicines have come closer to us, and also the different treatment modalities. So treatment of prostate cancer, I'll divide it into three.
Yes.
Number one is the medical management using what we call chemotherapy. So we have medications that treat the prostate cancer. These will either be in tablet form or they will either be in IV forms. And these medications these days, they they help to kill the cancer cells and stop them from dividing. I said the cancer cells are cells that are dividing the way they want. You can maybe say zewagula. Zikola bye zaagala. Omubiri guzigamba twagala 2 bo bakola 10. So this medication will go and kill those cells. When we kill those cells, we go ahead to monitor our patients. Ideally, in my practice, after I've declared you cancer free, after 3 months, I'll check on you. Every 3 months for 6 months, then every 6 months for a year, then every year for about 2 years. And when I see I'm not having any of these, I'll declare you cancer free and you continue with your life. The other treatment modality we have is surgery. We've said when we identify the prostate has an issue, especially the prostate cancer, we can remove the prostate, or that what we call radical prostatectomy. We can go ahead and remove the entire prostate or remove the bits that have the cancer. You can, as a man, you can live without a prostate. But if you have prostate cancer, then this reduces your chances of surviving. And now we have what we call radiotherapy. Abamu bakayita okalirira oba masanyalaze. So at our Cancer Institute in Uganda, we are able to do different forms of radiation therapy. And these are basically these radiations are targeting these cancer cells to destroy them so that we don't have any new ones that are being formed. And then we have hormone therapy. There's a male hormone called testosterone, and this testosterone is one of the things that the cancer cells use to grow. So we try to give medications that block its action, and these medications are available especially in the cancer treatment centers. You will not get cancer treatment everywhere. The only challenge we find that people refer to the Cancer Institute and it's a very busy place. You find someone is waiting for days to get to see a doctor. The numbers are overwhelming. That's why the government is now trying to decentralize the cancer care. We now have a center in Gulu and in Barara to sort of limit people all coming to Kampala for the service. But in private practice, I happen to work in a private hospital where we are able to do this, and we work with oncologists. We don't have so many oncologists, so we also need to encourage our children to study and become doctors who specialize in cancer, because we don't have so many of those. We've seen many people now going to India, because especially those who can afford, but no, my poor farmer may not be able to go to India because the costs are so high. So my key takeaway points are: identify the symptoms that you have, come and screen. If you're suspected to have the cancer, start treatment. Do not miss your treatment. Some people start feeling better and they think the cancer has gone. I know the treatments are hard and harsh. The side effects are more than the benefit at time, but you need to know that it's a process. Yeah.
I remember in 2000 when I went to South Africa, there was a new invasion or a new modality called PSMA that was using radioactive material in nuclear medicine. And then this would target actually the prostate cancerous cells. And many of them actually, there was a good progress using PSMA in managing cancer. So again, we are saying with early detection of cancers, cancer is no longer a death penalty, but rather how fast and how well and to what degree you're going to receive cure is totally going to depend on when you report it or when it is diagnosed and your behavior when you have it. Doctor clearly say that the biggest number of people diagnosed with cancers today are dying because of lifestyle. They diagnose with prostate, but then you start sleeping around. So as we are still managing prostate, you also catch HIV. You're smoking non-stop. You're drinking as if your world is ending tomorrow. So meanwhile, cancer still kills people, but majority of these are dying because of things that we can actually prevent. Uh, what are some of the emotional, doctor? What are some of the emotional and psychological challenges men face after diagnosis?
Okay, so most men, when they are diagnosed, they feel that this is a death sentence.
Mm,
Many of them feel like the world has come to an end for
mm,
them because of the issues some men have in their bedrooms. They have marital issues.
mm,
So we've seen marriages break, but sometimes what is breaking them is the prostate cancer or the enlarged prostate,
mm,
especially the elderly men. Most of them come in psychologically depressed because that's a very important part of their life, and if they lose it, then you find their women start going out for what they cannot offer to them.
yeah.
But the other thing is, when diagnosed, there's some bit of stigma in the community when someone
Mm,
is found to have cancer.
mm,
Some people still believe you can get cancer through handshake, sitting with someone. Those who are not educated, but those who know the science know that that is not possible.
mm,
And then the cancer journey, I've said the treatments are very many, but coming for them, you need to be escorted. If you don't have someone who is in your life to help come with you to hospital, imagine after a session of radiotherapy and you feel so weak, you
mm,
can't even move. So we need to walk the journey with them.
mm,
This is what some of the things that prompted me to go ahead and do a course in psycho-oncology so that I can see how we can walk this treatment journey with our patients.
mm,
And then there are those who come in late. We diagnose them and tell them, you know what, you can't even start treatment. You're so sick to start treatment. The treatments are available, but they are not for you. Just wait unto the Lord to call you. Those are very hard discussions we have with patients, and their families at times have a lot of hope. Sometimes they start moving around and they get the same information. For you to start cancer treatment, you must be able to tolerate the side effects. That means you must be feeding well, you should be strong. A very weak patient will not be able to go ahead to withstand these treatments. Themselves, they can end you.
mm,
So I just encourage you to screen and screen and screen. If you have your husband, encourage them to screen. How I wish these were routine. In the developed world,
yeah.
I've just come back from South Korea, and every year, every man has a given test that you're supposed to do.
Mm,
Some are supported by the government. The government supports a general checkup, one
mm,
checkup every year, and it is mandatory for you to go back to your work. It means your boss will need you to have fulfilled this to be able to be at work or even to
mm,
access certain services. How I wish our governments can also help us with improving our health and making it a priority. So screening is still very hard for us. In the UK, you get notifications on your phone. You are due for your PSA. You are due for your scan for this. And we need also to keep records. Some of our parents died, but we don't know what killed them. So we
yeah.
never know it was prostate cancer. So need
Mm,
to do autopsy or post-mortem to know what diseases are killing our family members. If it's prostate cancer, then what do we need to do as a family? We need to
mm,
educate our boy children. We need to take them for screening. So the cancer journey is a very long journey. From the point you're given this, some people think it's a death penalty. You have cancer.
mm,
And normally that discussion, for me, I always want to take all the time I want. If someone wants to cry, you be with them. We need the empathetic and compassionate health workers. Some people think telling someone they have cancer is like telling them a hello. It does not mean that. It's a very big blow to their life. Some of them even you don't want to let them go home. Some of them end up, let me go and commit suicide, let me go and the car ends me. So we need systems right away with counseling services. When you have a cancer diagnosis like this, your work is interrupted. You're ever sick. After your sessions of chemotherapy, you cannot report to work. So, as family members, we need to support these people. If he calls you for some token of to help them out in any way, please do, because they really go through a lot.
Mm. Uh, Doctor, as we're about to conclude, uh, how important is diet, exercise, avoiding alcohol, avoiding smoking in preventing prostate cancer and improving recovery in those that have been diagnosed with cancers?
Okay, so the most the most effective ways of controlling all cancers is going to be around two things: exercise and diet.
Mm,
So a healthy diet means this is a diet that is rich in many vegetables, many fruits, and reducing the bad fat.
mm,
And then exercise comes in to control our weight, because some of
mm,
these mutations that our cells undergo are due to certain changes or in the different diets that we choose. So
mm,
exercising will help reduce our weight or moderate our weight, and this reduces our chances of getting the cancers. But remember, we talked of certain things we don't have control over, the other risk factors, the family history, being black, the genes that transmit this cancer. Because I said this is a
mm,
familial cancer, it runs
mm,
in different generations. And these mutations happen when we have bad diets. So watch
mm,
what you eat. Is it killing you or is it saving you?
mm.
So I think those are very key. In all cancers, when we're teaching our patients, we tell them about this.
Uh,
Exercise, diet.
yes, doctor, as we near the end, from a medical perspective, what role should government and health institutions play in raising awareness and improving early detection?
Okay, so I think institutions, I would begin with the media stations. I wish they
Mm,
could give slots to educators to talk about
mm,
these diseases. And then government also needs to invest more in health communication,
mm,
targeting different people. Let's translate these messages in the local languages that people understand. Not everyone will understand English,
mm,
but when we break them down, we've seen this being done a lot for HIV, family planning, but
mm.
men are always left out. You
Yeah.
realize that it's either
Mm,
children or women.
mm.
We are on our own. So I wish.
Batuvaako dda tukola bye twagala.
So
Mm,
we really need messages broken down to break the myth we talk about, to teach
mm,
people about these cancers, up to down there. Every health worker has a role. If you have any
mm,
platform, please utilize it to teach your followers about something. Now even the village TikTok has reached there. If what are you using for your TikTok? What are you using your social media arenas for? Use them to teach something so that we can stay healthy.
mm,
In the developed world, you find billboards talking about these issues, but in our settings, we will not see that.
mm. Doctor, Uganda has recently held several main health awareness campaigns. Have you seen any progress so far with these?
The progress is a lot in the cities and not in the villages.
Mm,
Remember, majority of our population, according to the recent census, is in the villages.
mm,
So if you're targeting mostly the towns, you leave out the villages. And we talked about people who utilize the pesticides and herbicides and fertilizers at the walimi in the
mm,
villages. How are we
mm,
helping them? So messages and most of the awareness is a lot in the towns. You rarely see
mm.
them in the villages.
Okay. Finally, Dr. Nkalu, before I let you go, what message would you leave to Ugandans that have watched in this morning about courage, screening, and saving lives?
Okay, so I would like first of all to thank all our listeners who have tuned in and are following us, those
Yes.
commenting. Thank you for the good comments. And the key message I would like to tell them is that prostate cancer is curable. It
Mm,
means obulwadde buno bujjanjabibwa ne buwona. No
mm,
Rachel, you need to screen early. Genda weekebeze mu ddwaliro eddungi. Bw'ozuula nti olina obubonero oba bakutegeezezza nti olina obulwadde buno, genda mu kifo ekituufu otandike obujjanjabi. Go to the right place and start treatment. You'll only get the cure if you go early and you're treated early with the right medications. I can just briefly comment about the prognosis. The prognosis of prostate cancer is one of the excellent ones.
mm,
And what we see is 99% of the patients who are diagnosed before this cancer spreads to other parts of the body, then your chances of living after the diagnosis is beyond 5 years.
mm,
But if you come late, then you have a few months to a year at most.
mm.
Mm.
Um, Dr. Nkalubo, I'm reliably informed you're supposed to be on another media station at this time teaching about another healthcare topic. And I really want to thank you so much for accepting to be with us even on a very short notice. We appreciate. Thank you so much. And we really want to thank you and to ask you to kind of come again each time we invite you to come and speak to us on other non-communicable diseases, as we shall be letting you know. And so officially, I want to let you go and attend to other things if that is your will. Thank you so much and have yourself a blessed Sunday.
Blessed Sunday too.
Okay. Uh, Dear colleagues, I want to thank you for watching in up to this moment. That was a discussion on prostate cancer. Again, someone, like I always say, men, 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 we are the engines of our homes, the FA engine. We so many times take care of our children. We take care of our women. We build great homes. We always make up good politicians, good leaders, but we always forget the most important thing, and that is taking care of ourselves. If you're a man and you're above 40 years, please go and do a prostate cancer screening. This is going to save you. The doctor said that the prognosis of prostate cancer in early detection is almost 95%. Kitegeeza nti ku bantu 100 be bacekinga cancer wa prostate ng'obudde bukyali abantu ebitundu 95 ku buli 100 ku bantu 100 kitegeeza abantu 95 bawona. So that means there is chance if this cancer prostate is treated early. But do you know what we do? We don't want to screen. In other countries like America and other Western world countries, when a man clocks 40 years, it is mandatory that you do a screening every 2 years for prostate cancer and cancer of the stomach or colon cancer or rectal cancer, something like that. So, dear men watching from whichever part of the world you could be watching me from, we have one life and we are the engine of most of our homes. When that engine breaks down, trust me, that home you fought so much to build is going to go into shatters or is going to be shattered. Please, if you're listening in and you're above 35 years, you are 40 and above, go and do a simple blood test called PSA. In most places, it's going to cost you less than 10,000. Go and do an ultrasound scan on your prostate and bladder. In most cases, this scan is going to cost you less than 30,000. But I'm telling you, this 30,000 and 10,000 is going to save you millions of money. Like I say, cancer is no longer a death sentence. It is you to turn it into a death sentence when you don't do early checkups or when you don't detect it early. I really want to thank all of you that have watched in up to this point in time. People that always turn up every Sunday to watch, comment, distribute these videos. There are YouTube pages that people pay for, but this is still free up to the end of the year. And the reason is simple. We want to pass out information to every person that understands the language that we are speaking. And I promise you, I'll keep coming here every Sunday, even if there is only one person watching in, because this information is meant to save someone in some household. So I would ask you to be generous and kind and share this information with every man in your life. They could be church circles, they could be business friends, it could be your father, it could be your boyfriend, it could be your husband, but also it could be your son. If they get this information early enough, then they are able to pass it to their peers, but also they are able to do the right thing when that time comes. Remember, Nelson Mandela said that the best way to transform a society is through knowledge. I believe I've done my role as Mr. Self-Care to pass on the knowledge to so many people. It is your role to do the same to people within your circles. I always tell you that when you share this knowledge with this, either on your status or in those groups, you clearly don't know whose life you're going to save. It could be that you're going to save the life of your best friend, the life of a father of your best friend, and all that. Just like you share so many memes, I kindly ask you to share this video with everyone that matters in your life. It could be your father. It could be your father-in-law. It could be your pastor, Reverend O'Shea. Men are busy people that don't normally take things seriously. If you could sit down and watch it with them, you would have done us actually a bigger favor. It is the month of October, and we want to create as much awareness about cancers as possible. Still to come in the coming weekends will be breast cancer, will be a session on how nutrition and diet actually aids in preventing, treating, and managing patients that have been diagnosed with cancer. But also we are going to have a session on imaging. How do laboratories, ultrasound scan, MRI machines, nuclear medicine work in order to support cancer awareness, screening, and treatment and management? I want to pass a word of appreciation to friends that are working at Uganda Cancer Institute and friends and organizations that are working directly to support patients on cancer treatments, to support people that have gone for screening. My friend Philmon, who is one of the heads of imaging at Uganda Cancer Institute, and a friend, thank you so much. Again, I also want to thank the government of Uganda for extending cancer treatment and management centers from the one sole center, Mulago Cancer Institute, to now regional referral centers in Gulu, in Mbalala, and other places where they are soon opening. It was late, but we thank government that at lastly we can have these patients actually go to other centers. Because look, we cannot have Cancer Institute alone in Mulago handling less than 5,000 people, managing about a population of 50,000 Ugandans. I still want to urge the government and all those concerned that if possible, we should actually start having a cancer ward, maybe a minor cancer ward at every government or referral center. Every district hospital should have a cancer ward, because cancers now are many, affecting both children, youth, and adults. We should work on accessibility, because there are people who just give up on life simply because he lives in Mukono. When he thinks about coming to receive treatment in Mulago, sometimes the money to bring them becomes a problem. So I kindly ask our dear government to push to set up more cancer treatment areas almost in all parts. If not, let us have a minor ward at all district hospitals such that these people can come and receive their medicines from there. Imagine a patient coming from Lida, coming to Mulaganda, he has to receive treatments every 2 weeks. What are chances that this person will be able to come for 7 times or more? So I still urge you, policymakers, to make cancer screening, treatments, and all the management plans more affordable. I also urge you, investors, to invest heavily in cancer management and treatment centers. We should start coming up with private hospitals that manage cancers. We need more imaging modality. Like I said, I was in South Africa, and South Africa now, they have invented a technology called PSMA that properly treats cancers almost in all stages. And I've seen a lot of success stories. But we cannot have it in Uganda, even with experts like me that fully qualified in this, simply because there is no place to work in. To the business people that are investing heavily in betting companies, betting and other things, lodges and what, can we put more investments in healthcare, especially in non-communicable diseases like cancer? Because we don't know who the next victim is going to be. We don't know who the next culprit is going to be. I'll end this by going through some of your comments. I think Olivia is saying maybe that's painful if you can't afford a scan. Yes, it is painful because some people, it is true, some people cannot afford a scan, and that's why I urge government to make sure to continue providing the free scanning services. By the time I left Mulago for school, at least we still had free scanning services, and this was also happening in the rest of government hospitals. So, Malka Nadia Nanteza is saying, certain herbalist told me musawo chimanyi mponya prostate. Mulwadde wange tebamusalako akanyama. Yes. If you go to all bathrooms in Kampala, abazabasajja, you're going to find stickers of so many people claiming how they cure prostate cancer using herbal medicine. Now, I'm not here to dispute the capacity, but personally, I've not been part of that success story, and yet I've scanned so many people who've been diagnosed with prostate cancer. So this is a calling to friends who work with herbal medicine. If you feel that herbal medicine actually is able to treat people with prostate cancer, we have a full ward of people with prostate cancer at Mulago Cancer Institute. Go speak to Dr. Oriem. I tell them I have this medicine, because there are people who have lost hope in various stages. Let it be tested. It could be that your drug works out, but the problem is people cooking all kinds of grasses, and you cheat people already in pain, people already been diagnosed with cancer, you waste their time and you cheat them. At the end of the day, by the time they resort to coming to hospital, cancer has already moved from the prostate to all the nearby organs. I've been part of study scans where someone's cancer has spread up to the shoulders, so the bones start breaking one by one. When you ask them, most of them have been going to the shrine thinking this is witchcraft, or they have been drinking jerrycans and jerrycans of herbal. So to people dealing in herbal medicine, please, let's be kind. Let's be more human. Why would you cheat someone already diagnosed with a disease that can end his life in less than 5 years? So I really ask that we be more human. Jordan says, I really needed this. Thank you, Jordan. Flavia is saying, thanks for the show. It was very informative. Thank you so much. Chizito Helena is saying, thanks, Dr. Nkarubo. Yeah, I hope you will read this. Then Joseph Dembe saying, thanks for the good program, Mr. Chimboa and the doctors you always host on this show. Thank you so much, Joseph, for always tuning in and commenting. And then Malka is saying, thank you so much for this session. Again, thank you so much for listening. Ladies and gentlemen, I believe this has been an enlightening and powerful discussion that we've had this morning. And on behalf of everyone at Mr. Selfcare Studios, the producers, the directors, and everyone in the marketing department, we really want to thank Dr. Jonathan Nkarubo, who shared with us this morning his professional guidance, heartfelt passion for saving lives in Uganda, creating awareness, and preaching about early detection. I personally believe we've been impacted. And also we thank him for reminding us that prostate cancer is actually not a death sentence. When we act early, we can win this fight. To our viewers across Uganda and beyond, thank you so much for tuning in and for listening and learning and commenting. Your presence here this morning means you care about men's health. If your boyfriend, a girlfriend, your presence here actually means you care about your boyfriend, and I ask that you share this important knowledge with them. And remember, knowledge is the first step about the real change that we want to see as a product of Mr. Self-Care. I want to ask you to keep this conversation going. Please talk to that brother. Engage that father. Remind that husband or boyfriend. Encourage them to get screened as early as possible. If not, escort them. Let them get this medical advice when there is time, actually, for cure. Remember, doctors say that 95% of people diagnosed in first stage completely get healed or get cured of this cancer. I believe together we can end the silence and break the stigma that has been surrounding prostate cancer all along. I'm a Bible believer and a Christian, and I want to remind you a reading in the third letter of John, that is verse 1. That's chapter 1, verse 2, that said, Beloved, I pray that you may prosper in all things and be in good health, just as your soul prospers. Let's make that our prayer and commitment. I pray that I also want to pray for everyone watching that you prosper in good health, just as you continue nourishing your soul with the word of God or with whichever word that you believe in. To live healthier, longer, and more informed, you need to keep watching and informing yourself about different healthcare conditions. As an advocate of Mr. Self-Care, I always want to tell you there is no good health without self-care. And self-care starts with you. But practicing self-care actually starts with getting information about your health and then advocating or understanding self-awareness. The more you understand yourself, the more you're going to understand your body when it gets out of shape or when you can't understand it the more. Once again, thank you so much, Dr. Nkarubo, and all our audience today. Stay informed, stay healthy, and remember, early detection of diseases actually saves life. Have yourself a good morning. But in a special way, before I leave, I want to wish my daughter a happy belated birthday. Ainsley Atara Kusinza, I wish you a happy belated birthday, and may God protect you, keep you safe, grow up to be a great doctor or medical personnel like your dad, and continue the good work of this program and become maybe Miss Self-Care. From everyone on my end, we wish you happiness, joy, and peace on your end. Have a blessed Sunday, and may God bless you. Bye.